Thank you. Senator Blackburn.
Thank you, Mr. Chairman, and welcome. We are delighted that you are here and look forward to having you move out of this committee, be confirmed on the floor, and get over to CMS and get busy to work. You have quite a job in front of you, and I appreciate the time that you gave when you came to visit with me. As we discussed, changes to healthcare delivery, transparency, electronic health records, all of that is not going to happen here in D.C. It's going to happen in places like Nashville, Tennessee, and individuals that are entrepreneurial in their new starts in their companies that are addressing so many of these delivery and access issues. And as you've heard, there's great frustration with Medicare, Medicaid, the fraud that exists. There's frustration with entities like CMMI that can't do their job, and they need to either get to work or they need to be shuttered and that money used elsewhere. And there is frustration with coding. I would remind my colleagues that it is the American Medical Association that supports many of them that is responsible for coding, and it is time, I agree, to simplify that system. And I know you have thoughts on that, and I look forward to your being able to tackle that issue.
Senator Blackburn, I enjoyed our visit, particularly highlighted the reality that everyone should be aware of, that Nashville has become the healthcare finance capital of the country, with a lot of very innovative souls making major advances in healthcare. We want to empower those kinds of companies to start playing a role with the development of better services for Americans and also cost savings for the American people by building a better mousetrap. To do that, they have to know where we're headed. The first thing you learn in hosting, whether it's a television show or a garden party, is telling your guests where they're going. And I don't think CMS has done that adequately. I'm hoping that if confirmed with strong leadership, we'll be able to message very clearly where we need help and where there are opportunities for us to do better. By engaging the private sector wisely, I think we can challenge some of the incumbents, get some wise insurgent ideas to be seen and tested. CMMI has a history of failed projects, but I think with strong leadership, it will do very well.
Well, let's hope that they do. I do want to talk with you about the low wage index. As I mentioned to you, we've had 16 hospital closures over the last decade in Tennessee. 13 were in rural areas. The first Trump administration put a fix on this, and then the Biden administration let it expire. No guidance, no direction, and it was like our rural hospitals just had the rug pulled out from under them. Can I get a commitment from you that you will indeed address this disparity?
You have my commitment, if confirmed, to address broadly what we have to do with rural health care in America. It's not just hospitals. As we discussed in your office, there's some great institutions, 300-bed hospitals built in 1970 that really shouldn't be a 300-bed hospital anymore, even though it is the only place to get care in that area. We have to provide a better solution for the people in those areas, a financially viable one for the community, and one that actually protects the state coffers. If Medicaid is consuming a third of the budget in Tennessee, which is approximately what it is doing, it's crowding out schools, it's crowding out infrastructure, it's crowding out services that are valuable for folks around the state, and we're eating ourselves from the inside out by not dealing with this wisely.
And you've heard several of us mention Medicaid funding and concerns there with the fraud that exists in Medicare and Medicaid programs. And every time someone defrauds one of these programs, whether it is on providing care or receiving money that is not theirs, it really hampers the ability to get care to people that need it. Another area of fraud that we've noticed is the non-U.S. nationals that are crowding into the program, and individuals that are illegally in the country that are receiving Medicaid benefits that ought to be going to U.S. citizens. Will you work with us on cleaning up these roles and moving them out of the program?
I look forward to ensuring that the determination of Medicaid eligibility is done accurately and honestly. Same for Medicare. I saw an article yesterday highlighting what California has been able to accomplish, taking money from federal coffers to fund exactly the programs you're describing within their state. It's a smart move if you're a state that can pull it off, but it's not the right thing for the American people because we're all in this together.
Thank you. Yield back.